And we are back. In response to a growing need for better maternal health outcomes for women of color, a new wellness center is opened in the Norwood section of the Bronx. Now, born out of the grassroots organizing, the center aims at addressing maternal mortality crisis affecting Black and brown families in New York. Joining me now is the co-founder at Maryam Reproductive Health Wellness, Myla Flores, and we've got you here with us, and thank you for being with us.
Thanks for having me.
This is really a very important topic because when we talk about reproductive health and wellness, obviously, there's so many people who are women who are really struggling and dealing in this area, and you guys are really, aiming to really close that gap.
Truly. When we think of the positionality within the United States, one of the most resourced countries, yet having some of the worst outcomes when it comes to experiences and some of the maternal health crisis that many of us already know about. Some of us don't. We aim to nurture the Bronx as a result of New York City being so much more impacted. So the Bronx within New York City, within New York State, within United States, we want to center a borough that is significantly under-resourced, yet put together the collective maternal health professionals who are interested in solving this problem, who are local, and many of which are rich in so much knowledge, education, passion from OBGYNs, midwives, nurses, who have come together, doulas, childbirth educators, all with and for and really multilingual in ways that want to expand the resources and access to community-led reproductive GYN care and a plethora of other wellness services.
Yeah, I've got a friend, we've actually grown to become friends, who's actually introduced me to the fact of infant mortality. I was sitting around dealing with, a panel, and they asked me to come and be a part of this discussion. And as there, I became really familiar with the fact of how much infant mortality affects communities of color, and the whole process that you sometimes talk about with, these maternal challenges that many people don't know about, but communities of color sometimes face in quiet and private. And I want to get your take on that because, there is this crisis out there that sometimes people aren't speaking about or can hear as loudly. And from your lens, how are you addressing that? Because I know that's a part of your mission as well.
So one of the things you brought up earlier, you talked about social determinants of health. And when we think about the context within New York and individuals of color, Black individuals who are experiencing racism and a range of different contributions to their experience, when we look at the individual as a whole person and not just someone who is pregnant with a baby right now, but when we think of the span of the reproductive experience from menstruating to then being in preconception to then being pregnant and then postpartum, we are seeking to fill that gap of improving the experience of individuals who can know more about their bodies well in advance of being pregnant. So one snippet of the different community education and programs we have is a youth program where we've had teens through their early 20s coming to Maryam, learning and having conversations that are not normally had in their schools. And sometimes they're like, learning about like their fertility in ways that it's not about let's get pregnant. It's about how does your reproductive system work? What kind of ways can you feed into your health now, regardless of if you choose to have a baby? And one of the things that I'm inspired by is some of the commentary on just having accurate information coming from young people, which isn't very common. And so it's one of the concerns that a lot of parents have had, and they've brought their kids over to the womb bus, which is like part of our journey towards creating a birth center. We had the womb bus, and now we have this wellness clinic, Maryam, which we're talking about now, and then the future birth center. But one of the parents had said, it's really nice and refreshing to know that my child is coming home talking about some of these topics. And then she brought her parent in to have an STI screening, which she hadn't had in like many years. So
Right.
like the thought of the generations having knowledge on some of these important topics, I feel is going to impact infant health because we're talking about healthier bodies.
Right. I think you tapped into what I was going to talk about, because I wanted to get to the place of conversations. Sometimes it's hard to have conversations as a parent with your child, and some people don't know what to say, don't know how to say it, but it's almost like, you're the middle person here, that you're able to actually help someone, a young person be able to have that conversation, and then subsequently go back home, and a parent also to be able to say, listen, and you just gave a great example. And I think that's one of the things that, you could say that's a plus, is that the generations have the opportunities to now learn, talk about reproductive health, wellness in ways that we weren't having necessarily.
Totally, and we did an activity before starting this program, and we've had 2 groups of youth where we were asking Bronx natives, like, tell me about your sex education, and the things that they would say just was obvious that we need more, and tell me what kind of education you would hope for, what you would want for our generations to come. And that's what helped inspire this. And, one of the other comments from one of the young individuals who's non-binary was, not feeling comfortable necessarily talking about their period. And then by the end of the program was totally like, wow, I'm glad that we talked about this, because now I'm more aware of my emotional life before, during, and after, and I can give myself a little grace, because I notice and I think something's up with my mind sometimes, but when in fact I can actually make observations that I wasn't normally able to before, connected to my menstrual cycle.
Interesting to find out, right?
Yeah.
Well, we got some things happening, and I want to be able to talk about a couple things. You got the Uptown Love Down event, and talk to us about that.
Okay. Yes, the Uptown Love Down event is a community event where we are taking the opportunity to pour into families, pregnant and postpartum. Some of the awesome grassroots organizations that are focused on parents and family have joined hands to create an event that's going to be at Motley Kitchen, and we're excited. We have 200 spots and a few left, and we're going to have massage, raffles, gifts. We're going to have midwives there who are helping people hopefully get a better understanding of the position of their baby. And Maryam's going to be totally repping there with some of our massage therapists present, and Bronx Rebirth, Ashe Birthing Services, Earth Grounds. We have like a really dope group of people who are putting this together, and what we're proud of about it is that we commonly are participating as like one small part of something that has so many organizations that we don't even know, but like this is all BIPOC-led reproductive health organizations that said, let's do this. And so it's September 29th.
We'll make sure people are getting out there to check it out.
Yeah.
It's been great having you.
Thank you.
All righty, well, appreciate you stopping through, and want to let you know, if you want more information, please visit the website at maryam.com. Don't go anywhere. We talk about now relationships coming up right after the break.